The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and welcome to the latest edition of the Health and Fitness Show. I'm your host for today, Suliman Rafiq, and we are broadcasting live from the studios of Inspire FM today on Thursday the 14th of November 2019, reaching listeners in Luton and surrounding areas on 105.1 FM. As always, you can join us via the Inspire FM website, and if you prefer to watch as well as listen, you can do that via Facebook. All you have to do is go to the Inspire FM Facebook page and click on our live link. Having your interaction on the show makes all the difference. I was really grateful last week for the numbers of WhatsApp messages and calls we got. So why not get involved again? And you can do that by text or WhatsApp on 0777 948 1822. That number again, 0777 948 1822. Or if you prefer, you can call the studio and speak to our expert guests on 01582 481822. That number again, 01582 481822. So this month is Oral Cancer Awareness Month, and today's focus will be on the topic of mouth cancer. And rates have soared in the UK to reach record highs. While rates of most cancer types are falling, disease of mouth has bucked the trend and has shot up in the last 20 years. Last year, 7 people died from the illness, which affected over 8,000 patients in the UK. And I'm delighted to say that we have 2 expert guests in the studio who will be shining a light on this important health topic and will be telling us more about an exciting upcoming event in Luton to be held at Luton Central Mosque on Westbourne Road on Wednesday the 20th of November. So without further ado, if I could just ask my guests to introduce themselves. I'll start with Sue.
Good evening, Suleiman, and good evening, listeners. My name is Sue Jordan, and I'm Assistant Director with Community Dental Services, and my particular area of interest is oral health improvement.
Fantastic.
So, good evening, everybody. My name's Glen Taylor. I am a Senior Dental Officer for Community Dental Services in Bedford, and I'm here to share some experience about oral cancer with you.
Great. Thank you very much for giving up your evening to be with us and telling us more about the work that will be happening in Luton. Just before we get onto the topic of mouth cancer, can you just tell us a little bit more about your organisation and what they do generally as well?
Yes, Community Dental Services, both Glenn and I are really proud to be employees. This is a different dental practice from what you'd find on the high street. We are a social enterprise, which means that we came out of the NHS some time ago, back in 2011. And it means that we can offer more to our patients and deliver oral health in ever more communities. We're also an employee-owned organisation, which means that each one of us has a stake in the organisation, and therefore we're really passionate about what we do to make sure that we are able to achieve as much as we can with our patient care.
Fantastic. And I've been aware of the organisation for a while. We've known each other for quite a while now, Sue, and I know the fantastic work that you do in reaching out into so many of like Luton schools, etc., and you know all the great work that you're doing to try and improve oral health throughout the town. So just thank you very much for all that you and your team for all the work that you're doing.
Thank you.
Just in relation to oral health, you know, a lot of us will shudder at the thought of dentists and the like, but can you just share some kind of top tips for good oral health generally?
Yes, of course. Oral health is really, really important because that is the gateway to the rest of the body. So what we find, there are key messages we'd like to share with the listeners tonight. And the first one is about oral hygiene. Looking after the mouth, making sure that people are effectively cleaning their teeth and their gums. using a fluoride toothpaste, and that's for babies as well. So it's really important that people are brushing at least twice a day with a fluoride family toothpaste, and when they've finished brushing, that they spit out but don't rinse out with lots of water, because that washes away the benefits of a fluoride toothpaste. So that is the first thing. And if people are using a mouthwash, not to use it the same time as brushing, because that will again wash out the benefits of the fluoride toothpaste. We recommend tooth-friendly snacks in between meals. And there's caution here because a lot of food has free sugars. Suliman, I know you know all about this. So it's really important that we give our mouths a rest from having sugar, and really, if we can keep sugar just to meal times, that's the best time. And certainly throughout the night, for children particularly, that they're not drinking milk throughout the night, just water if they need a drink at all. Visiting a dentist, extremely important, and we'll be talking about that importance this evening. So it will depend on your own oral health, how often you need to go to the dentist. So for some adults, it may be every 3 months, 6 months, it could be every year or even 2 years. But it's important that all adults go, even if they don't have the natural teeth. And of course, with children, they should be going from 6 months old, so they may not have any baby teeth, but it's really important they go along to the dentist and have preventative care discussed with their parents, and then go every 6 months because their mouths are developing quite rapidly. Mm. So those are the key messages, really.
Absolutely. And I think it was, ironically enough, it's just a few weeks ago, we were actually, we were talking about oral health, just generally in the office.
Of course. And
as you do, a clearly exciting bunch. And it was one of the points you made at the beginning there about not actually spitting out the toothpaste. It's just something that we all just do. Yes. Well, a lot of us do, and we shouldn't really be doing that. I think it's quite it's quite unknown, isn't it? You know,
it's something. I tell you, the children know about it, because
great.
We've been working with those. It is difficult for adults to get into that habit of spitting out and not rinsing out with lots of water.
Yes.
It's something that we find it's interesting.
It's quite an alien idea, because you think you should rinse the toothpaste away, and you're rinsing away any bits that are there, but you're actually rinsing away the good stuff in the toothpaste that's going to protect your teeth.
Yes, yeah, absolutely. And the other thing as well is it was again not naming any names, but it was just,
go on, Suliman, go on, name them.
We were just talking about the fact that often a lot of us brush once a day, and that will generally be in the morning, but actually it's more important to brush before you go to bed.
Yes.
Yeah,
very much so.
Last thing at night, yes, for all of us, children and adults.
And adults, so across the spectrum.
Yes,
it's actually not to say you should brush twice, so that's everyone's agreed. At least twice. You should be brushing at least twice, so that's the clear message. But of those 2 times, it's actually the one before you go to bed that's more important.
Yes.
And then,
Now, the reason behind that is because if you don't brush before you go to bed, you could have little particles of food still in your mouth, which is natural, and they'll be there. And the digestive process begins in your mouth. And acid is produced in your mouth, which you don't realise, and that could be going all night long. So that will actually affect the teeth, and you can start to get cavities, and the tooth basically slowly dissolves away. That's how you get a cavity. And if you brush before bed and one time during the day, that's the current recommended way to go forward.
Fantastic. It is something I have your voice in my head before I'm like, I got to brush my teeth before I go to bed.
I've been nagging you for a number of years now, Suliman.
So I always try to remember that. Absolutely. And the other really important point you made there, which was around starting your child going to the dentist from 6 months, and so for some children they will have next to no teeth at that stage.
That's right.
So for some parents that might feel as though they're wasting the dentist's time and the NHS's time, etc. So can you just elaborate on why you would take a child at 6 months to the dentist?
It's quite the opposite. Definitely not wasting the dental team's time. Early intervention is very important when it comes to reducing the levels of tooth decay, and particularly in Luton, because children's teeth is still the worst in the east of England. But nationally, we have a campaign called Dental Check by One, which suggests that babies from 6 months start going to the dentist, and the family will receive preventative advice. So the baby will grow up, hopefully, with good, strong teeth. It also works really well because new mums, have free NHS dental treatment until their baby is a year old. So to take along the baby 6 months is great, because that's when we would expect mum to go along anyway. And then they can get another visit in too. Before the first birthday. So really important that preventative information is given out, because a lot of us have old wives' tales, particularly around teeth. So it's a really exciting campaign to have babies going along.
And it's also a good thing to bring, if you bring the little one to the dentist early, they get used to going. So they get the experience of going. You might not get a full examination on the first visit, but the fact they've been, and they might sit on the chair and play with the chair, and the dentist can sort of play around and have fun with the family, and just, make it an enjoyable experience, will be invaluable going forward.
Absolutely, and they're registered then, aren't they? And then everything's kind of taken care of. And so just to be clear as well, for children, is there a cost for dental care for children?
Absolutely free.
So
absolutely free for NHS dentistry. They can also get fluoride varnish as the baby grows a little bit older. They can have fluoride varnish applied twice a year, free of charge. And for some children that are at greater risk of tooth decay, they can have it applied 4 times a year. This is really good. These are great preventative measures. So they're free, get free NHS dental treatment until they're 18 or 19 if they're still in full-time education. So make the most of it.
Absolutely. Anyone that knows me knows I love to save money. So, if there's anything, just...
children's teeth will be fine.
Keep going till you're 18 and you've got to pay for it, son. So that's been really helpful. And as you say, Luton, unfortunately, we do have very high levels of tooth decay within children, and the number of teeth that are having to be extracted in very young children is such a concern for us as a town. So I'm just conscious that we are here to talk about mouth cancer specifically today, because I could talk to you about child's teeth all
I'll come back.
Absolutely. Hopefully we will. And then just in relation to a basic question, and that is, why do we have Mouth Cancer Action Month?
Well, this is a national campaign, and it's been going for about 20 years now, and it's really an opportunity for the whole month of November to raise awareness about people's mouths. People often don't look inside their mouths, so the purpose really is to raise awareness so that people can understand the signs and symptoms of oral cancer, and hopefully have confidence to go along to a dentist or a general practitioner, a GP, a doctor, if they see anything different in their mouths that hasn't recovered in 3 weeks. So 2 to 3 weeks is a key time for people to see if there's any recovery in their mouth. If not, they really must seek professional advice. It's very important. Glen's going to be talking about that importance.
Great.
So the campaign is for the whole month, right across the country. Lots of things happening. Today it's Blue Wednesday, so a lot of people will be wearing blue.
Oh, okay.
And unfortunately, Glen and I are not.
No. Well, to be fair to you both, it's Thursday. So.
Oh yes.
I'm sure you were yesterday.
Yeah, that's true. That's true.
It's very dark blue.
Yeah, that's
dark blue,
get out of jail free card. So that's good to know. And what partners are involved in Mouth Cancer Action Month?
Well, locally, certainly Public Health from Luton Borough Council, which is fantastic. We get a lot of support from them. And what's really, really exciting this year is the community and faith leaders that have been involved in organising the event next week. Next Wednesday. We also make sure that other partners such as our partners work in residential homes, our early years, because they have families and extended families. So we get the information out as far as we can, and even using social media.
Fantastic.
So, yes.
And so, as you just touched on there, we will be having a specific event in Luton,
yes.
Which we're really excited about. And it's great that, again, thank you very much for making the effort to ensure that Lutonians are getting, services on their doorstep. Can you just tell us a little bit more about the event next week?
Yes. Now, this is really exciting for us because we're having our mobile dental unit, and it's a huge van size clinic, and it's fully functional with everything you could want in any dental surgery, and that's going to be driven into the Central Mosque, and that's at Westbourne Road. We're going to be there between 10 and 4 o'clock. I'm delighted that Glen is going to be the dentist that's going to be offering free oral screening, and I emphasise the word free because it's so important. People don't realise that dentists can save a life, and that's just by 2 minutes screening. Completely painless, so those that have been a little bit nervous about going to the dentist in the past, please come along. We'll have a dental nurse there too, and my colleague and the oral health improvement manager for Luton, Sharon, she and I will be there to offer information and support people and do all the paperwork before they go in.
Fantastic.
So we're very excited about that. It's right in the heart of the community in Luton.
It really is. Everyone would know where Central Mosque is,
yes.
bang in the centre of Bury Park. So you can't miss it.
Yeah.
And just to be clear, then you're there next Wednesday. How long does it take for the check to?
The screening no longer than 2 minutes.
Literally 2 minutes.
It's literally
right.
We will just have a look around the mouth. We'll look at all the areas that are the most important areas. So we will have a look under the lips. We'll look at the floor of the mouth. We'll have a look at the tongue, the roof of the mouth, the back of the throat, and we're just checking all the most common areas where oral cancer can appear.
Yeah.
And we're just looking for anything that's unusual. We're looking for red patches, red and white patches, ulcers. That's, as Sue said, that have taken longer than 3 weeks to heal, and anything that looks different. I'm not a specialist in oral medicine. I'm a very good general dentist, and I can spot difference. And if we do notice something unusual, we'd refer you on to the correct people.
Great, fantastic. So it's literally 2 minutes, and it potentially could save your life.
Absolutely. I think that's a really strong message to get across. Before people go in to see Glen, there's some little bit of paperwork because we do need their consent.
Yep.
And obviously, if there's anything that's suspect, that might be raising a little concern, we will need their consent to write to their GP.
Sure.
So there is a little bit of paperwork beforehand, but it really is very quick. So we want loads of people to turn up. We really do.
Fantastic.
Yeah.
Now,
Glen is very good. He can multitask.
Yeah. You seem friendly enough, Glen.
Yes.
I do try.
For a dentist. I do try. And so we've just had a few questions in from our listeners. Thank you very much for our listeners for getting in touch. Just a reminder, that number is 01582 481822, or you can text or WhatsApp us on 07779 481822. So one of the first questions, just to clarify again with children, is around being able to register your child at age 6 months. So you shouldn't be turned away at that stage.
No, and people don't register anymore. They can go to any dentist, but they shouldn't be turned away from 6 months. It'd be useful to know if they are. We're very lucky in Luton. It's a town out of 13 towns across England that's piloting a programme called Starting Well, and these practices are really keen to work with the local community and also to encourage families in. So they have activity days, they're going out and talking to parents as well. So those are Starting Well practices, and if anybody wants any more information, they can contact me direct. Or Luton Borough Council, my colleagues.
Yeah.
Because, they should be able to go to a dentist.
Great. So thank you very much to the listener for that question.
Yes.
And just a comment in relation to oral cancer here, that the seriousness of oral cancer, I think, because often, so this is just making the point about the seriousness of oral cancer, but to add to that, I think it's fair to say it's one of the not as well known, because cancer, I think, gets a lot of attention, at various different types of cancer, but this cancer isn't as well known. But the listener here is saying that they had someone in their family who unfortunately died from mouth cancer. Which is obviously, very sad in terms of, when, like you're saying, if some of the signs and symptoms can be spotted relatively easy in comparison to some of the other cancers, then it is something that we should be trying to do more around. Can you just give us more information around some of the statistics for people that don't know the levels of mouth cancer?
Yes, certainly. And as you said, mouth cancer is not one of the most promoted cancers to be aware of, but the latest, the 2020 figures is that 7 people a day could die of oral cancer, which is quite shocking. So overall total figures from last year were 8,337 people were diagnosed with oral cancer. Okay, and early detection is the main key survivor. If you're detected early, your survival rate is between 50 and 90%. But the problem with oral cancer is it doesn't tell you it's there until very late.
Right.
So you usually don't have any symptoms. You may have a little red spot or a red patch or a little ulcer, but it doesn't tell you it's there for a long time. And it could be bubbling away and you don't know. So having a screening, having it checked and having someone look around just to check everything's okay is really important.
Yeah. And is it generally for people that are older, or is there any correlation between age and mouth cancer? Do you know?
All cancers as we get older are more common, but it can happen to anybody at any age.
Right.
So we can sort of park that one. But as we all age, we are more at risk of all cancers. That's a fact, unfortunately. But it can happen at any time. So just because you're a younger person doesn't mean you're immune from getting cancer, and especially oral cancer.
Absolutely. I mean, we're fast approaching our advert break. I mean, after the break, I know just before the show started, you spoke about as your experience around some of the personal stories. We'd love to kind of know more about that specifically as well. We're also going to be looking at how mouth cancer is spotted early and what some of the risk factors are. So, around shisha, for example, smoking cigarettes, diet, diabetes, this kind of thing as well. We're going to be exploring more around some of the risk factors to give people a fuller picture around what the importance of recognizing this cancer specifically. And also, just again reiterating the fact that we do have this opportunity next Wednesday on the 20th at Westbourne Road to see yourself and get checked out for free in relation to mouth cancer, and the importance of regular checkups as well. So just generally, when you do go to the dentist, should a dentist be looking for that as part of their general?
They will do. They will
do,
but they probably don't publicise what they're doing.
Right.
So when they're looking around at your teeth, they'll be looking at all the soft tissues. They'll be looking at the cheeks. They'll be looking at the tongue. And again, we're trained to spot difference. So if we see something unusual, we'll spot it very quickly.
Sure.
But they might not say, "I'm looking for cancer," because they don't want to scare you.
Yeah. I'm glad they don't say that. If I wasn't scared enough already. Absolutely. So that's really helpful as well. I mean, just in relation to smoking, just before we go to the break, is that the most common reason for mouth cancer?
Tobacco and smoking is a major risk factor.
Yeah.
Definitely, yes.
Yeah. But it's not the exclusive reason. So
no, it's not the exclusive reason, but tobacco and smoking are major risk factors. There are other risk factors, which include alcohol.
Okay.
So someone that was a smoker and consumes alcohol, it increases the risk factor tremendously.
Sure.
Okay. But there are other risk factors as well. So as we were saying, a poor diet is another risk factor.
Yeah.
So if you're not having your greens and your veg and that kind of thing, that's not good. Yeah. Stress and your environment can be a risk factor. So if you're unfortunate and you don't have your own home, and that could be the last straw that tips you over the edge. So there are lots of things that you wouldn't think of that are risk factors.
Absolutely. I think because diet is one that we often talk about in relation to other things on the show, but wouldn't necessarily correlate to mouth cancer specifically.
The two biggest risk factors are tobacco, smoking, chewing tobacco, or smokeless tobacco, and alcohol. But all the other little risk factors can all add up to cause the problem.
Sure, absolutely. And I think we've mentioned it previously on the show around there's myth around shisha and how that isn't necessarily dangerous, but actually what the evidence shows is it's extremely dangerous, and an hour of smoking shisha is equivalent to smoking 200 cigarettes.
There's figures like that.
The statistics as well. So, as I said, we will be going into more detail around mouth cancer, spotting the signs, etc., and some personal stories. So, listeners, please do stay with us, and we'll be back after these short breaks. If you do want to get in touch, as a few of you have, appreciate that. You can do so on 01582 481822, or you can text or WhatsApp us on 07779 481822. It's 07779 481822, and stay with us, and we'll see you after this short break.
Assalamu alaikum, this is Atif Nawaz. Listen to Inspire FM shows in your time by heading over to inspirefm.org or listen on Apple Podcasts or Spotify.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and welcome back to the latest edition of the Health and Fitness Show. I am Suliman Rafiq, your host for today, and we are broadcasting live from the studios of Inspire FM today on Thursday the 14th of November 2019, reaching listeners in Luton and surrounding areas on 105.1 FM. As always, you can join us via the Inspire FM website, and if you prefer to watch as well as listen, as I know a number of you are, you can do that via Facebook, and all you have to do is go to the Inspire FM Facebook page and click on our live link. Having your interaction on the show makes all the difference, so why not get involved? You can do that by text or WhatsApp on 07779 481822, or you can call the studio on 01582 481822. Today's topic is all around mouth cancer, and for any of you that missed the start of the show, I'm just going to ask my guests to reintroduce themselves. If I start with Sue.
Hello, Suliman. My name is Sue Jordan, and I'm Assistant Director for Oral Health Improvement with Community Dental Services.
Hello, Suliman. I'm Glenn. I'm a Senior Dental Officer for Community Dental Services in Bedford.
That's great, and thank you again for giving up your time this evening to be with us. It's cold outside and you're going to have to drive back, so coming down to Luton is really much appreciated. So the reason why we're talking about mouth cancer is as part of Oral Cancer Awareness Month, and to highlight some of the work that's going on in Luton specifically, with an event that's been organised for next Wednesday, the 20th of November, at the Central Mosque on Westbourne Road, between 10 and 4.
That's correct.
Fantastic.
Yes,
I'm listening.
Yes.
You'll be able to come down and get an oral health check, to spot some of the signs and symptoms around mouth cancer specifically. So just to kind of recap, can you just give us that statistic? It was quite a bold statistic around mouth cancer.
Yeah, so currently there are 8,337 people a year are diagnosed with mouth cancer, and that equates to roughly one person an hour.
One person an hour.
One person an hour being diagnosed with mouth cancer.
And
obviously the listener that messaged in earlier that had the sad loss in the family, that's more common than people realise. So 2,700 people a year will lose their lives to mouth cancer, which is a horrible statistic, and that's roughly 7 people a day.
Yeah, in the UK.
In the UK,
wow.
just in the UK.
Yeah, absolutely. That is higher than I thought, my ignorance around this specifically. So just to, before we get back onto the specific issues around mouth cancer, we just had a few parents messaging in around the taking their children to the dentist, and if you had any kind of top tips on being able to persuade children to get to the dentist and things like that in your experience?
Well, first of all, I would like to say before Glen comes in is please do not worry, because it doesn't matter as long as you get the child through the door, that's a great step. You know, and sometimes families that I've spoken with, they say, well, I've been 3-4 times, they won't open their mouth, they won't sit on the chair. It doesn't matter. It's just that routine about going, and it's part of their normal development to go to the dentist. So just don't worry, because the child will pick that up. And one thing is, please do not say words like, oh, you're going to the dentist, oh dear, or, oh, I don't like going to the dentist. I know you don't like going to the dentist, Suliman. But please don't say it to children, because they start worrying about things they don't know, and it's going to be a fun event. And not to worry if they don't open their mouths. But Glen, if you
I mean, if the child doesn't open their mouth on the first visit, it's not a problem. It's just getting them used to going, the environment. A top tip is if they do have any brothers or sisters, go with the brothers and sisters, particularly if it's an older brother or sister that has been to the dentist and knows what to do. You'd be surprised how well the younger ones will copy or even will want to sit with their older brother or sister.
Yeah, absolutely. And I know for my children, they're booked in every kind of half term or every term, or and there's like colouring books and stuff like that. And there's a real effort being made to try and make it a little bit more child friendly than when we were going, you know.
We tried to make it a lot more fun. I mean, in my surgery in particular, I mean, I deal with children and adults with additional needs, and I'm mainly a referral-based dentist. But my practice, I have got models which are it's a little dinosaur with little plastic teeth, so we can sort of show them what we're going to do. We show them what a mirror is and how we're going to use it. We've got a little blue unicorn, which we sort of say, you know, this is what the unicorn's going to do. Would you want to try and do that? And even if they just want to sit on the chair on the first or second visit, we can just go up and down on the chair, so it's like a fun ride. See if you can touch the ceiling. Away you go.
Fantastic. And there are now like good like YouTube videos and stuff like that, isn't there? Around, you know, like cartoony kind of style.
Certainly to support brushing.
Yeah, absolutely, to support brushing, because that's another thing around children not necessarily brushing correctly. One of the questions here is, so we mentioned that you should, as a minimum, be brushing twice a day. But is there, what would you say like the maximum was, if there is, you know, could you excessively brush?
You can excessively brush, and you can wear your teeth away, but you'd have to be brushing an awful lot and for a long time to do that. So the current guidance, the current advice is to always brush twice a day, always before bedtime, and then one other time in the day. So if you can't make it in the morning, or if the kids don't want to do it in the morning because they're getting late up, or they don't want to go to school and you're having difficulties, they can do it when they get in from school. But as we said before, the nighttime brushing is one of the most important ones. Yeah,
absolutely. And then just the final one is around electronic toothbrushes for children. Is that something that is recommended for children? For adults, it's the preference, isn't it?
Adults, it's a good way. I personally use an electric toothbrush because I'm lazy, and it's an easy way of brushing. I haven't got to think about, if it's early in the morning, I just put the toothpaste on, turn it on, hold it against the teeth and let it do the job. Just move it along slowly. So it's, for me, it works really, really well. And for most patients, it will give you a better clean. Not for everybody. If you've got a perfect technique, it won't. It will give a good technique. But for children, if they like the electric toothbrush, and there's lots of toy-inspired electric toothbrushes, Elsa at the moment, Frozen. If they like it and they will use it, and it encourages them to use it, it's absolutely fine.
Absolutely. And so for just to be really clear then, for the question is, so for children, electric toothbrushes, no matter how young, is fine for the child, isn't it?
I wouldn't do it for a baby, a very young baby, but for a sort of 4 to 6 year old, if they can hold an electric toothbrush and they're finding it easier and it encourages them because it's got their favourite toy on it, then yes, it's a good tip to use to encourage them to brush.
Fantastic.
They still need adult supervision.
Yeah. Okay.
So stereo. Until they're about 8 years old.
Okay.
So, it's absolutely fine.
Sure.
If they don't mind the vibration of the noise. Some children don't like it, but if they do, that's absolutely fine. But still, an adult needs to supervise.
So why does an adult need to supervise?
Well, because the child, as they're growing and developing, they haven't quite got the dexterity to be able to get to the places they need to. And that's another reason why we get caries in the teeth, because we're not brushing the food away and we get the acid build-up, as I said earlier. So a younger child can't manage to do that on their own. They have a good go at doing it, but they can't get to all the areas. So my top tip to parents is, once your child can colour in a colouring and they don't go out of the lines, they're getting to that stage where they should be able to brush on their own. But until they can do that, you need to help them. You let them have a go, let them do it first and let them have a good go, and then take over and get to the areas they might not be able to reach.
Right.
And the other thing with the brushing is obviously the 2-minute recommendation. Children don't realise how long 2 minutes is.
Sure.
If you get your child to sit down and close their eyes for 2 minutes and put their hand up when they think 2 minutes is up, they'll never get it right. They usually stop after 30 seconds.
Yeah, absolutely. So the other reason is around making sure they're doing it for at least 2 minutes.
Yeah.
Yes.
So 2 minutes is the time.
2 minutes is the current recommended time.
Yeah. I'm working up to that. And with our Healthy Smiles programme in Luton, we have introduced daily supervised toothbrushing. And the children are doing marvellously. They're getting fantastic support from the people that are working with them.
Great.
But the children are doing really, really well. And that's anything from 2 and 3 years old.
Sure, absolutely. Yeah. So 2 minutes is an important reminder as well, isn't it? Because often in the morning you're rushing around, etc., etc. But you need to be making sure you get that 2 minutes in
for effective brushing.
For effective brushing, and most importantly, before you go to bed as well.
Before you go to bed and any other time in the day. So if you do miss the morning, don't panic. You can do it when you get in from school. But as long as you're doing it twice a day for 2 minutes, you're on the right track.
Sure, absolutely. And so just bringing it back in, thank you again to our listeners for their questions. It's really appreciated. In terms of your interaction and, making the most of the fact that we have these expert guests in the studio here with us. So just bringing it back down in relation to the mouth cancer and the mouth cancer screening event. Can you just recap some of the details around the event?
Yes, so it's Wednesday, 20th of October, between 10 o'clock and 4 o'clock. We've got our community dental service mobile surgery going to the Central Mosque. This is really, really exciting for us. And the Central Mosque, if you don't know, is in Westbourne Road. We've got the mayor going to see the launch as well. We're grateful to the community and faith leaders for helping us organise this over many months. It takes a long time. And the whole idea is to raise awareness around oral cancer. Glen will be there with a dental nurse to give a free, absolutely free screening. Only takes a few minutes, and Sharon and I will be there offering oral health advice as well. And a few Phoebes.
Okay, sounds good.
See you there, Suliman.
Sounds good. And so just to mention as well is, as you say, you highlighted some quite shocking statistics there around mouth cancer. But can you just bring that down to a personal level around some of the people that you've supported personally?
Yes, certainly. Now, as I said before, early diagnosis is key to survival rates. So if it's spotted early, your chances of survival are really increased. So I can give an example of a patient who didn't realise they had a problem. We just noticed a red patch in their mouth. It was on one side of the cheek. We referred them to the oral surgeons at the hospital. They did a biopsy and diagnosed the oral cancer. It was removed and treated, and successful outcome, and the patient's doing very, very well. I've got another story of a patient who wasn't my patient, the wife was my patient, and he'd visited an emergency dentist to have a tooth out, a wobbly tooth. He was a regular attender, but he didn't have any pain or problems from his mouth. He had the wobbly tooth taken out, and then his wife saw me and sort of said, "Oh, my husband's extraction isn't healing properly." And I replied, "Oh, when was it done? Last week or 2 weeks ago?" And she went, "Oh no, it was 3 months ago." So to me, that was a big red flag, and I sort of asked him to come in as an emergency to see me immediately. It wasn't very obvious that he had a problem. It wasn't that there was a slight swelling, but I took a large X-ray picture and I noticed something I wasn't happy with, and the fact it wasn't healing for that long is a big signal. So we did an urgent referral, and he's still with us, but it was quite traumatic for him. He had to have a large section of his face removed and his jaw removed, and he had to have it all plated. But his wife and him are still very grateful because he's still with us. And it isn't a nice thing to talk about. You know, sometimes when you have to have this done for the survival, it isn't pleasant, and there will be trauma. It could affect your speech, it could affect your swallowing, your taste, and if you can get it early, the less chance of having these horrible things happen to you.
Absolutely. And you know, we're so fortunate here. Just when I was doing a little bit of research around this topic in relation to the treatment that then, you know, from the NHS that is available, the specialists that we have that support people that have been diagnosed with mouth cancer specifically, you know, you are then very well kind of catered for once it's been diagnosed and you know, taken forward via the NHS specifically. Again, just for anyone that didn't hear about it in the first half around some of the risk factors. So we mentioned smoking and alcohol, drinking alcohol was the other one, but also diet.
Smoking and alcohol are the two biggest risk factors. Smoking on their own or alcohol on their own, but combined it makes the risk skyrocket.
Sure.
So that's the two biggest thing. But diet is a risk factor for most things. So if you have a poor diet and you're not eating some greens and some healthy fruits and vegetables, that's not good for your health in general. The other thing we said about your environment. So if you're unfortunate enough not to have your own home and you're in a stressful environment or an unstable environment, could be your working nights. These can be the little tiny things that push you over the edge.
Absolutely. Just had a question in relation to for the event next Wednesday. Is there any booking system? How's that going to work?
Well, there are two systems in place. Our partners at the Central Mosque have got a day list.
Okay, great.
So people can put down a time that they would like to come along. But it's also open to other people in the community as well. Yeah. So if they're in the area, and I know it's very busy around there, they can come along because it doesn't take very long. The only thing is, on our dental mobile surgery, there is a very small waiting room at the back of the clinic. And it is really, really small. Sure. So hopefully the weather will be kind to us, so that people, you know, are not going to get cold or wet or anything like that. But, you know, I really would like to see lots of people come along. Absolutely. And even if it's just for some information, but to have that free screening, I think, is a bonus.
Yeah, absolutely. Yeah. And so for anyone listening that is working in the local area, local business owners, etc., you can literally pop along in your lunch break.
Yes.
And, you know, it takes a few minutes to get checked out. So do take that opportunity on our doorsteps.
Yes, please.
Just a question, will the screening van be going anywhere else in the future, or how does it work?
We have it because we are covering a very wide area. We have clinics all over the east of England and into the Midlands as well. So we have dental mobiles going out to key places. For instance, yesterday it was in Oxfordshire. It was,
yes. I was in Oxfordshire and we were at the county hall and we had, I think, 70 plus people come along for the examination screening, which, as I said, takes a maximum of 2 minutes. Yep. And then we gave them oral health advice and some advice about any advice they wanted to discuss at the time. Great. But obviously, if we have a big queue of people, we can't go into great details about their dental problems because we're mainly there for the oral cancer screening. But we're there we're happy to give advice if needed.
Fantastic. Yes. You're going to have much more fun in Bury Park. You do know that.
Oh, it's going to be fabulous. So. It will be fabulous. The people are wonderful.
You'll be well looked after, I'm sure. And you said the mayor's coming down as well?
Mayor, yes. Very keen to launch this campaign. And we're excited about that too. So we have quite a lot of dignitaries coming along, which really shows the effort that people have been putting into this event to get everybody involved. So yes, come over and If you want a photograph taken with us, that's fine too.
And just a question in regards to how an individual might themselves spot some of the signs and symptoms. What are some of the signs and symptoms around mouth cancer specifically? So
if you have an ulcer or a sore that's taking more than 3 weeks to heal, 3 weeks is the key number, then go and get it checked. Okay. That's a major thing. If you spot a red patch, a red and white patch, or a white patch in your mouth, go and get it checked. If you find a lump on your lip or on your tongue or on the side of your mouth or on your head and neck, go and get it checked. So the tagline from the Oral Health Foundation for this month is, if in doubt, get it checked out.
Sure. So what was that last one you said?
So if you've got a lump in your mouth, on your lip or on your neck or somewhere, or even on your neck, it's worth going to get it checked out.
Okay, great.
I think if you think anything from your lips to halfway down your neck, those are key areas to think about.
Sure, yeah, absolutely.
I guess what I'd like, though, from your listeners today, Suliman, is to go to a mirror with a pretty good light there as well, and have a look at their mouths, lift their own tongue, what's underneath there, because people don't have a look. And this is a really great opportunity during this campaign month to have a look at the mouth, see what it looks like now. Are there any, things that might just trigger a thought now, or if it's healthy now, and if there's any changes, they'll know what's changed. So the key thing is go and have a look.
Yeah.
A nice mirror.
Yeah.
You can ask your friends and family to look inside your mouth, but you might want to do it in the privacy of your own bathroom.
Yeah, absolutely.
I want to say one tip that usually if you've got something on both sides of your mouth, it's usually you. It's usually not a problem, but it could be worth getting checked out. If something is new and it's on one side alone, then that is usually another trigger that you should think, oh, okay, that's different. I should get that checked.
Sure. And so you're actually encouraging people to have a look themselves.
Yes.
Yes. You can look under at your lip, you can look at your cheeks, you can look at your tongue. It's much harder to see the roof of the mouth and back of the throat, but if you notice something, or you've got some hoarseness at the back of the throat and it's not healing, as you said, or the ulcer or the sore that's taken, like my case example of the gentleman who had the tooth out and the extraction wasn't healing, that's a big giveaway.
Sure. And so obviously we'll all be brushing our teeth tonight, because although I'm sure most of us do every night, for those that might not, then they will be from today onwards. So perhaps that might be the opportunity to check it out.
Absolutely. Yes.
And how long do you spend kind of looking around? Because some people they'll end up seeing something that isn't necessarily there. Do you see what I mean? So what would you say?
They don't need to spend too much time looking. It really is getting familiar with their own mouth, and this is one of the key things of the campaign, is just be mouth aware.
Okay.
And I would suggest, and this is backed by the charity Oral Health Foundation. You should check him out about once every 4 weeks, so once a month. Yeah. Make it a regular routine thing to do, because we're all encouraged to check ourselves, and the mouth gets neglected often. But it's so important. That's where you notice about somebody when you first meet them is their smile. And we use our mouths for eating, and that's really, really important for general health. And often if things go wrong in the mouth, that can have a huge impact on general health too. Absolutely. So it's the mouth is key.
So we ourselves should be checking every 4 weeks, and hopefully we should be going to the dentist as adults every 6 months.
It will depend on the individual, actually, won't it, Glenn?
It will depend on your needs and your specific sort of case. Okay. Some people will go 3 monthly, some people twice a year, some people once a year, some people could be every 2 years. It all depends on your actual oral needs. So the days of the 6 monthly checkup are gone. Okay. It's all tailored to you now. So if your needs are higher, the dentist will want to see you a bit more regularly just to maintain everything, to make sure everything's okay.
Okay, that's good to know. And so, because I still had the old school 6 months in my head, so I'm just every 6 months.
Some people are familiar with it and they're happy with it, and the dentist won't argue with you. They'll say, if you're happy to do that, please do. But the dentist might say, actually, you could go to 9 months if you wanted to. Absolutely. But I have some patients that say that when I say that the regulator NICE would say 9 months is good for you. But they say, oh no, I'm happy with 6 months. I'm quite happy with them to see them every 6 months.
Absolutely. But the key is, whatever the time period, that there's a regularity towards it. And then one of the things they might not tell you they're looking for, but they will be having a little look around.
So the dentist will definitely be looking around at all the soft tissues in your mouth while they're looking at your teeth, and looking, like you said, for anything that's different that shouldn't be there. And they will be checking those things, and that's the person that can refer you on. Your doctor can refer you on to a specialist, but the dentist is probably the person that will spot it, because, as I said, oral cancer usually creeps up on you. It doesn't hurt until the time when it's getting too late. And then once you're there and you want to go and see somebody, we don't want it to be too late.
Absolutely. So early identification is the key.
Yes.
Listeners, we've literally got a few minutes left. If you would like to get in contact, you can do that by text or WhatsApp on 0777 948 1822. So the time has kind of flown away with us, and next week we'll have Fahad Matin back in the studio here in the hot seat. Just before we kind of wrap up for today, I was just keen, obviously you both have a wealth of experience. Is there anything else you'd kind of like to share with our listeners while you have this opportunity?
Mine is an appeal to people that don't have natural teeth anymore.
Okay.
So they may have dentures, false teeth, but it's still important that they go along to the dentist. And again, for them to check the mouths. We work quite a lot, spend quite a lot of time in residential homes with people, older people, vulnerable people. And they often will say they don't want to be a nuisance, but unfortunately they let things develop too long, and then the outcomes aren't very good. So it is important, even though they don't have natural teeth anymore, to get their mouths checked out. Really important. Yes.
No, it's interesting. It's not something that we often talk about, but it's an important area. Absolutely. Glenn?
I'd agree. So that just going along and having a screening, a general health check, because obviously the dentist is checking your teeth, they're checking your gums, they're checking for oral cancer, even though they might not be telling you. That's a really important thing. So it's a general health screening. There are lots of different little things that can be spotted from inside the mouth. So it's not just oral cancer. The dentist might notice another area which has changed, which might be another condition which could be referred on to a specialist.
Sure, absolutely. So then just finally, in terms of conclusion, we're very, very fortunate in Luton that we'll be having the screening event on Wednesday, the 20th of November at the Central Mosque in Bury Park. And you'll be there between 10 and 4. And it literally takes a few minutes to
2 minutes
get
maximum.
checked out. So we'll see everyone there next
Hopefully,
Wednesday.
People are queuing round the corner.
The more the merrier.
Fantastic. Until next time. Assalamu alaikum.
Thank you for listening to our podcast. We stream our daily broadcast on inspirefm.org. You'll find all our daily updates on our social media at Inspire FM Luton.